Hey everyone, so this week I've been asked to create a video for neck strain and neck pain. What you have to remember is that the neck, cervical spine sits on top of the lumbar spine. And lumbar spine, it sits on top of the pelvis, right? So it's all about the core. If our neck is forward, which we are, life happens in flexion. So unless we strengthen our core and sit up nice and tall, we'll never get the neck in a position where it needs to be. And what you have to remember is our brain weighs between 20 to 25 pounds. And if it is shifted forward in this way, it puts a lot of strain in the back. A lot of chiropractors will tell you have a straight neck and it lacks the ability to absorb any of the shock that travels from your feet all the way up the spine to your head. So that's not a very good thing. And a lot of people have a lot of numbness and tingling from cervical radiculopathy, and it's the disc herniation occurs. And as we get older, we get stenotic, meaning the disc space between the vertebra gets very desiccated, meaning it gets really dry. So we really need to stay hydrated. We really need to pump that up. We really need to focus on the core and the posture to make sure we have this degenerative or decompressive effect in our spine. So today I just wanted to spend some time sitting up nice and tall to kind of create that kind of length in the spine and help you to be more aware to bring that forward so that you can sit nice and tall, always being mindful of that decompression. So sitting like this, if you can't sit with your legs like that, feel free to sit however way. You can even do this in a seated position on a chair. So I'm just going to place my hands, palms of my hands down, and I'm going to press down onto the floor. And as I do so, my shoulder blades are going to depress down. They're going to be focused on kind of pressing down, and as my shoulder blades go down, I want to feel this lift of my spine. So the crown of my head being lifted up toward the ceiling. So palms down, push down firmly, and as you do so, see if you can feel this lift in the spine. Draw the rib cage down and in, navel to the spine. Really get your core to be active to get that decompressive effect. It feels really good to shift up against gravity, activate the core, and decompress your spine in this way, okay? And you're gonna feel very light in your neck. So what I'd like you to do in this position, I want you to remember that position. This is how I want you to be. Press your hands down, shoulders press down. As you do so, spine lifts up, okay? And it's almost like you're floating on your spine. It's weightless. It almost feels weightless. And relax. So I'm going to press down again and allow my spine to shoot up, gaze up slightly and down. Again, inhale and exhale. Press down through the palms of your hands and lift. Feel this lift from the crown of your head all the way up to the ceiling. Navel to the spine, rib cages down and in and down. Again, inhale and exhale. Press down and lift. 1, 2, 3, 4, and 5. So get that in your body and see if that helps you, okay? Now what I want you to do is roll your shoulders up to your ears and pull them back. Just simple roll up and back, because what happens is our neck is forward and our 20 to 25 pounds shifted forward creates a lot of tension on our shoulders because it's trying to hang on to the weight of your head. And so it creates a lot of tension in the shoulders. That's the trapezius muscle, sometimes our levators and rhomboids, and a lot of the shoulder attachments get really fatigued, especially the suboccipitals, where the under your skull is where a lot of these muscles attach, and it gets really, really tight. So just doing those shoulder rolls back and, forward, and then go forward and back, just to kind of roll them out, to just give them motion there. Place your hands on top of your shoulders and just bring your elbows up and out, making circles with your elbows, keeping a nice chest open, right? We're making circles. And then I want you to go forward and pull straight back, and go forward and pull straight back. Pull forward and straight back, and just opening up the front side of your shoulders. Inhale forward and exhale back. Inhale forward and exhale back. And gently place your hands on top of your knees. Sit up nice and tall. Gently tuck your chin all the way down and lower your head down as you gaze down towards the floor. And then come all the way up and extend your head, gently stretching the front side of your neck. And go all the way down, sitting up nice and tall. And go all the way up. And down. And make sure you move very slow so you don't get nauseous or dizzy. And down. And up. One more. Down. And up. And I'm going to face you forward, and then I'm going to take my nose or my gaze all the way to the right, over my right shoulder, as far to the right as I can go. And come back center and go all the way to the left and back center. Go all the way to the right, back center to the left, back center, right, back center, left, back center, right, back center, and left. Why I'm doing this is we have a lot of mobility in our spine. As we get older though, as things ossify, meaning it gets really rusty back there. The bones get rusty. So a lot of as we get older, look at your parents. They lose the ability to move in full ranges of motion in the neck. So oftentimes, if you're in your 60s or 70s, a lot of my patients need a pillow because they're not able to extend their neck because they're so hyper-focused that you need a lot of cushion to lie on your back. If that's you, or if you're younger and that's starting to happen to you, it's in your best interest to make sure you have full range of motion and lubricate those joints so that they don't lose their mobility and they don't get rusty. Okay, so that's one. And then this next one, I want you to bring your nose to the left armpit. Go ahead and do that. And then with your left hand, place your left hand behind your head and gently pull it down, making sure that you're sitting up nice and straight. And pull it down so that you feel a nice stretch down the back, the right side of the neck. Take a deep breath in and exhale. It's like I'm asking you to smell your left armpit. Hold for 15 seconds. Gently release. Make sure you're not over pressing. Really be attentive to your posture and alignment. Sitting up nice and tall. I'm going to gaze down at my right my right armpit. Place my right hand behind my head and then press it down toward my armpit. And I'm going to feel a good stretch on the left side of the neck. Take a deep breath in and exhale. Take a deep breath in and exhale. Come back. And I'm going to interlace my hands behind me and I'm going to pull my arms back and gaze up. Sit up nice and tall. And I'm going to feel this intense stretch on the front side of my shoulders. Take a deep breath in and exhale. Take a deep breath in and exhale. Lastly, I'm going to interlace my hands, place it behind my head, sit up nice and tall, pull my elbows straight back. And in this open position, keeping mindful of my navel to the spine, and really pressing my spine up toward the ceiling, like activating my core to decompress my spine. Elbows back. I'm going to gently resist with my hands, my head coming back. So my head's going to press back into the palms of my hands, but I'm not going to move. I'm not going to let my head press into my hands by resisting, same equal amount of resistance back with my hands. And back. So you're going to push back into your hands with your head, 1, 2, 3, and relax. Push back into your hands with your head, 1, 2, 3, and relax. Again, 1, 2, 3, and relax. You see how you can't really see what I'm doing? But I'm doing it, it's called isometric contractions, meaning the length of the muscles don't change. So you don't really have to see me extend my neck. I don't want to see that. I want just a lengthening and activation of the muscles on the back side of your neck. That's all we want. And relax. One more, 1, 2, 3, and relax. And as you release, if you're one of those where your hands went numb, that's because our brachial plexus, all the nerve roots that exit the spine, and kind of makes a spaghetti junction in our armpits and innervates everything down below. The nerves that innervates our fingertips, that's getting really compressed through the armpits from being so tight. That's why I'm trying to open you up and really build length in your spine. So I hope this helped you, and next week we'll follow up with a little bit more core building and posture improving exercises that are Pilates and yoga focused to help you to achieve your optimal posture. I'll see you guys next week.